In the global pursuit of healthcare reform and innovation, much of the spotlight traditionally falls on the United States, home to world-renowned research institutions, pharmaceutical giants, and cutting-edge medical technology. Yet, a quiet revolution is unfolding halfway across the globe, positioning India, not America, as the most promising beacon of healthcare innovation. Through frugal ingenuity, rapid technological adoption, and government-backed initiatives, India is emerging as a model for sustainable, scalable, and impactful health solutions that could reshape global health outcomes. Frugal innovation with global impact. India's greatest strength in healthcare innovation lies in its ability to do more with less, a concept known as frugal innovation. Unlike the high-cost, insurance-heavy models seen in Western nations, Indian innovators operate under constraints that drive creativity and cost-effectiveness. A prime example is Karkinos Healthcare, which established a nationwide cancer care network for just $100 million. This feat becomes even more impressive when compared to the United States' $2 billion Cancer Moonshot program, which has faced criticism for slow progress and bureaucratic inefficiencies. Karkinos' model leverages decentralized diagnostics and AI-assisted decision-making, dramatically reducing costs without compromising care quality. Equally transformative is the Serum Institute of India, the world's largest vaccine producer. During the COVID-19 pandemic, it played a pivotal role in producing millions of affordable vaccine doses for developing countries. More recently, it introduced the R21 malaria vaccine at just $4 per dose, setting a new benchmark for accessible immunization against a disease that still claims hundreds of thousands of lives annually. AI and digital health, accelerating innovation. India's embrace of artificial intelligence and digital health technologies is another reason why it's outpacing traditional leaders in healthcare reform. The country is not merely adopting technology, it is actively developing homegrown AI solutions to solve pressing public health issues. The Wadhwani Institute for Artificial Intelligence, for instance, has deployed AI tools that assist in tuberculosis detection and maternal health monitoring, impacting millions of lives across rural and underserved communities. These innovations are not confined to labs. They are deployed at scale in real-world healthcare settings, delivering immediate value. Moreover, Indian AI startups are collaborating with global pharmaceutical companies to streamline drug development. For example, AI tools developed in India have cut document processing times in regulatory workflows from 40 hours to just 40 minutes. This acceleration not only improves efficiency, but significantly reduces costs, helping more drugs reach the market faster and cheaper. Government-driven healthcare transformation. The Indian government has played an instrumental role in supporting healthcare innovation through targeted policy interventions and strategic funding. A standout initiative is the Open Source Drug Discovery (OSDD) project, which brings together scientists from around the world to develop affordable treatments for diseases that Big Pharma often neglects, such as tuberculosis and malaria. At the same time, India has invested heavily in creating digital health and wellness centers in remote and semi-urban areas. These centers provide free or low-cost consultations, diagnostics, and medicines, and have served more than 30 million patients to date. Coupled with initiatives like Ayushman Bharat, one of the world's largest government-funded health insurance schemes, these efforts are creating an infrastructure that ensures healthcare reaches the last mile. Global recognition and influence. India's healthcare innovations are increasingly being recognized and adopted by international bodies. The World Health Organization, WHO, recently pre-qualified the R21 malaria vaccine, validating India's ability to produce affordable, world-class medical solutions. Meanwhile, India's concept of reverse innovation, where products designed for developing nations are later adopted by wealthier countries, is gaining ground. Western health systems, struggling with unsustainable costs and bureaucratic inefficiencies, are now studying India's low-cost models for clues on how to deliver more effective care. Publications such as Wired and The New Yorker have highlighted how India's cost-effective models and AI-driven healthcare systems could be the blueprint for a global health renaissance. The UK's National Health Service, NHS, for instance, has shown interest in incorporating India's cost-conscious innovations to revamp its own technology budgets. A model for the future of global healthcare, India's approach to healthcare innovation is holistic, inclusive, and deeply pragmatic. Instead of waiting for perfect conditions or unlimited budgets, Indian innovators and policymakers have built systems that thrive within limitations. They are proving that impactful healthcare does not need to be expensive, and that technology, when harnessed wisely, can bridge gaps in access and affordability. As the world grapples with aging populations, rising chronic disease burdens, and spiraling healthcare costs, the Indian model offers a powerful alternative. It shows that innovation is not solely the domain of wealthier nations or elite research labs. It can and should be driven by necessity, scaled by technology, and supported by inclusive public policy. The future of global healthcare innovation may no longer lie in the sprawling medical campuses of Boston or the high-tech corridors of Silicon Valley, but in the resourceful clinics of Bengaluru and the AI labs of Mumbai. India's unique blend of affordability, scalability, and technological dynamism is setting new standards for what healthcare can and should look like in the 21st century. For a world desperate for sustainable solutions, India is not just a hope, it's a blueprint.